Good afternoon, and thank you all for joining us. We are going to get started. My name is Julia Barfield, and I am the Senior Manager of Policy and Programs at the U.S. Chamber of Commerce Foundation. And we are so excited to share the data that we have today to tell you about the months of work that we've been doing and answer questions that you may have about our work. So I'm going to just jump right in. And bear with me in case we have any technical difficulties. This is the 2020 world, so I feel like we're gonna have to just pivot. So again, Julia Barfield, the U.S. Chamber of Commerce Foundation, for those of you who are not familiar with us, or if this is the first time that you're joining one of our webinars, we are the nonprofit branch of the U.S. Chamber, and our team works to support the business community, state and local chambers, to understand the importance of early child education and more broadly to support them on their education and workforce challenges. So our goal is to be a resource, to make connections, to provide data, which we'll be doing today, and really elevate early child education as a two-generation workforce issue. So that being said, we are coming at this conversation from an economic angle, and I want to recognize we're all joining it from different perspectives, whether you're a provider, an advocate, in a state agency, from a chamber or an employer. We're all coming to this conversation from a different angle. So I am hopeful that we are going to talk about how the data that we've found and the research we've done is applicable to you, but recognize that you may not necessarily fit into one of the buckets we're going to be talking about today. So today's agenda, a few just housekeeping things. We are recording this webinar, so we will send this to you after the webinar is done. Just give us a few hours and we'll send it via email to those of you who are registered and who weren't able to join us. We will be releasing a culminating report next week. So we'll be teasing a little bit of data that will be in that report. But this is a plug to please circle back and read that report, because it will be drawing together all the themes that we talk about today, wrapping up the 6 months of surveys that we've been doing. So for today, we're at the introduction and welcome part of today's agenda. I'm gonna start with a video that we created at the beginning of the pandemic to kind of level set what the childcare industry is looking like. This may be very familiar to you. You may be living this experience, but thought it would be a great way for us to level set with a quick understanding of what the childcare industry looks like. We also recognize that we created this video back in the spring, and things have, some things have changed, some things are still the same, but this is a video that is helpful to level set. Then I'm going to talk a little bit about the overall findings of the surveys. So we have done a handful of surveys and I'll dive into that, but just our top line findings of themes we've seen across the 6 months of surveys. I will show you another video that we created. This will be a little bit shorter, and it's some parent stories that we've collected, because we recognize that parents, if you are one, you're living this experience, but thought it would be helpful to hear their voices as well. And then we'll hear from our research team. I can't sing their praises enough. They're from the Cicero group, and I will introduce the three of them later, but they will be really diving into the data that we have found that impacts providers, that impacts parents, and impacts employers, and how those, the data points we've seen have changed over time, what has stayed consistent, and really dive into the data. And then at the end, we'll have time for a Q&A. I recognize that we won't be able to answer all your questions, but I'm hopeful that we'll have a good discussion. So with that, I'm gonna play this video. It does take a few minutes, so it might be, just bear with us as it loads up.
13 million American parents rely on childcare outside the home to pursue their careers and bring home a paycheck. But when COVID-19 hit, life and work as we know it came to a screeching halt. 75% of children are now at home all day with a parent or guardian, forcing millions of parents to reduce their work hours or take a leave of absence. Hardest hit are low-income Black and Latino parents, who are less likely to have remote work options and more likely to be laid off. Many parents are eager to get back to normal and back to work. So who will watch the kids? The global pandemic has been devastating to America's $47 billion childcare industry. 60% of the nearly 700,000 childcare programs in America have shut down due to COVID-19, and only 11% of providers are confident they can survive these closures without support. Childcare small businesses, who already operated on razor-thin margins, have seen their revenue plummet. Between parents' safety concerns, public health guidelines, and historic job losses, most are operating at only 1/4 their normal capacity. Fewer kids enrolled equals less income, plain and simple. At the same time, COVID-19 has increased the cost of doing business, requiring masks and expensive cleaning supplies, not to mention training on new operational procedures. You try social distancing with a 2-year-old. Childcare can range from home-based providers working with a handful of families to center-based providers with dozens of staff caring for hundreds of children. Like many small businesses hit hard in this pandemic, America's childcare providers, many of them women of color, are facing financial ruin. And many, in particular home-based providers, have been unable to access emergency small business loans due to logistical hurdles. More than 1/3 report layoffs or furloughs, putting the jobs of nearly 740,000 childcare workers in jeopardy. The result? 4.5 million families may lose childcare too. If we don't act fast, childcare as we know it may not survive this crisis. Childcare is essential for parents looking for work and growing their careers. It is crucial to our economy and our recovery. Businesses, policymakers, childcare providers, and parents can all be a part of the solution. Learn what you can do at uschamberfoundation.org/earlyed. Then help spread the word.
So just a quick FYI, we will be posting all of the survey links and the videos. I think they might be going to the chat, but they will definitely go in our follow-up email. So if you want to watch that again or spread the word, we'll be sharing that with you as well. So quick overview of the research that we've been doing. We did a lot of surveys, to be honest, and I'm really excited that they're wrapped up. But we did these surveys intentionally because we wanted to see how decision-making for parents and employers was changing over time. So we did 3 surveys of working parents, and the Cicero folks will dive into some of the logistics of who qualified for that. But just so you're aware, that was for working parents across the country. We offered it in English and in Spanish, online and via phone, but we found out very quickly that people weren't answering their phones. So it was mostly online for parents with children under the age of 6. So they could have older children, more than one child, but this was really for working parents. We also found out actually in the June survey, and I apologize to the Cicero folks if I'm jumping ahead, but we did have a lot of working parents who were unemployed right before the pandemic that answered. And originally we were thinking about not including their data, but thought it was relevant given that childcare is often a barrier for folks to get reemployed. So just so you're aware, we have an appendix in all of the surveys. So when you look at them and hopefully when you read them, if you have questions about who we surveyed, the demographic information, there's more in there. But we did these surveys in June, August, and October, again, to see how working parents' decision-making is changing over time. We knew that some states would open up more quickly. We knew that some would have pandemic outbreaks more quickly than others. And so we thought this time series was going to be helpful in some of the themes that we saw and generalizing what we're hearing from parents across the country. So then we also did employer surveys. We did 2 of them in June and October. And in all transparency, we distributed these through our chamber networks. So if you're a chamber listening in and you helped spread the word to your membership, we are incredibly grateful. So we thought it would be helpful for them to spread this out so that employers in chamber memberships were answering these questions, were informing our research, but there is a little bit of convenient sampling bias in that because these were through folks who we knew who then shared it with our membership. We found that we got a decent amount of sample or responses, from folks across the country, across industries, geography. We got a large amount of essential employers who responded. So that was actually kind of a surprising thing for us to identify differences between essential and non-essential employers. Those folks who are in different industries that are being impacted in different ways. And then size as well, because we know that some folks could qualify for small business support through the federal government, some did not. Some, small businesses were harder hit than others of different sizes. So we thought it was an interesting spread of responses that we received through these employer surveys. And then lastly, we interviewed childcare providers. We thought about a quantitative survey, but I know that there are a lot of our early education partners and advocacy groups in the field who have been doing childcare provider surveys, and we thought in-depth interviews might be a more interesting perspective to hear, in their own voices, what their understanding was, what their situations were. So if you are one of the partners of ours who helped us identify providers, if you're a provider who answered these questions or participated in this survey, just know that we're incredibly appreciative of the work that you did to help us really hear your perspective. We did get we saw themes across provider types, but we also were intentional about interviewing Head Start programs, early Head Start programs, for-profit, multi-state providers, small nonprofit providers, home-based providers, and really tried to get a range. I recognize 18 interviews is not representative of the nearly 700,000 providers that we have in this country, but again, we wanted a depth of understanding about provider scenarios, not just big picture. So key findings. Here are our top 3. I'm totally biased. We've written a lot, so I think there are probably more, but we really tried to boil it down to top findings. And they were that childcare arrangements are continuing to change. I'll dive into some of the data points, but this is not surprising to any of you working parents out there that, public health guidance changed over time. States are changing with what is and isn't allowed. Employers are changing and what they're asking their working parents to do. So we are seeing that childcare arrangements are changing. And we had called this a childcare equation, where any family knows that you are constantly juggling logistics of who's doing pickup or drop off. Do you have weekend support? What are your needs as far as like your family composition goes? Do your hours change? How does that constantly evolve in your childcare needs? And so we have seen that, no surprise here, working parents really haven't settled on one solution during the pandemic. Again, not a surprise here, children are more often at home with family and friends than ever before. I don't think, again, this will be surprising to folks, but this has remained consistent and has remained high, that more children are staying at home. And again, for an employer or policymakers who are considering solutions, it's important to know where kids are and if we're noticing any changes. And lastly, we found that parents are really at the risk of leaving the workforce. I'll dive into that a little bit more, but we had some predictions about folks who would be leaving the workforce, and then we've also seen it happening in real time. So continuously changing childcare arrangements. So to this childcare equation, even prior to the pandemic, parents were constantly juggling. Sometimes, a childcare center is closed, a kid gets sick, a home-based provider has to change her hours. Parents are doing this constant juggle. But what has been interesting is that we heard from more and more parents that their temporary solutions were unsustainable. So 2 out of 3 parents had changed their childcare arrangement in the past 12 months. And that change might have been going to, out of state, going to grandma and grandpa's house, going to a family, friend or neighbor to help pitch in, but it really was not a permanent solution. And even if it felt like it worked for a couple weeks, a month, parents really felt like they were going to continue to need to change things. They also said that they would, in every survey, June, August, and October, that parents would need to change their childcare arrangement in the next year. This was notable, again, because as employers are asking folks to come back to work, as states are, opening or closing, parents are still juggling and felt like their temporary solutions weren't necessarily a good fix. One notable point that I want to raise is that as of October, unemployed parents were more likely to need to change their childcare arrangement than working parents. And as we've seen unemployment spike over the past year, it is concerning to think that childcare is often a barrier for unemployed parents to get work or find work. And so as folks are thinking about policy solutions, or they're thinking about job opportunities, and families are trying to increase their economic stability, childcare remains a barrier for many folks. No surprise here, more children are at home with their family. So to level set, pre-COVID, about 52% of parents that we had surveyed had children that were under the age of 6 staying at home with family or friends. So that could be one parent staying at home, that could be, two dual earner income households, but the shifts are different. That could be a extended family member at home, but they were not in a formal paid out of home care setting. Approximately 25% of parents use childcare centers. I know that there's a lot of data out there about what pre-COVID childcare program utilization looks like, but this is from the parents that we asked what they had used prior to the pandemic. So again, no surprise here, at the height of COVID, most families shifted to caring for their children at home as employers went remote. Parents overnight juggled, I am simultaneously a full-time parent and full-time employee. And so really we've seen parents continue to keep children at home, not because they've got a solution at home, but because they are trying to figure out, I'm on Zoom calls from 8 to 10, and then I take a 2-hour break in the middle of the day. Partner and I switch shifts. It's a constant, again, this juggle of trying to figure out what to do. One interesting thing that we noted was that home-based providers and the utilization of home-based programs was returning to the pre-COVID rate of the parents that we had. So around 12 to 14%. Pre-COVID utilization was around 14%. And then now it's around 12%. And we think that that is probably because of the preference for smaller settings. But for any advocates out there, state folks, childcare providers, we know that home-based care has been on the decline. The supply of home-based care has been on the decline for some time now. And so it's an interesting trend that we've observed, that as parents are shifting to more, smaller setting preferences, that does have ramifications for childcare centers that are still open and trying to survive, and puts pressure on the home-based providers who we might not have the adequate supply to meet the demand. We also have seen that parents are at risk of leaving the workforce. And I know I've got to move quickly for our next video, but top line findings are, we had heard in June that 40% of employers were concerned that some of their parents may leave the workforce. And in October, 32% of employers had already seen employees leave the workforce, and half of those employees had cited childcare as the reason why they left the workforce. So employers were concerned, kind of had anticipated that folks might be leaving, and shortly thereafter had already lived that experience. We also saw in June that 1 in 5 working parents were unsure if they would return to their pre-COVID work situation. That meant going from full-time to part-time, changing employers, or leaving the workforce altogether. And every single one of those decisions has financial implications for families and for employers. And then in October, we had seen that more folks were returning to work or were sure that they would return to their work situation, but still 13% said that they were unsure if they would return to their pre-COVID work situation. Folks will dive into this later about the impact on parents, but we saw this was not, there were differences across gender and racial demographics. So, that 13% of folks who were unsure, we saw more women unsure if they would be returning to work or at risk of leaving the workforce. And we saw more parents of color at risk of leaving the workforce as well. So there were some significant differences. And lastly, one thing that was surprising to us was that a lot of parents felt like their school district's decisions would impact their ability to return to work, even if their child was not necessarily enrolled in school. It might have been because, you have multiple children, 1 or 2 kids are in the school district, and then, you maybe have one child under the age of 5 staying at home. And so it was interesting that oftentimes the childcare system and the K-12 system do not interact and connect in the way that maybe would be ideal, but that the decisions of the K-12 system did directly impact working parents. So speaking of working parents, I'm going to play a short video of working parent stories that we had created. We have a longer version if you want to hear their perspectives, but here's just a little clip.
I have taken now, I think 3 to 4 weeks without pay. And it doesn't help that we've been home 24/7. So the electric bills are through the roof.
Childcare issues should be the very last thing that people are worrying about during a pandemic. You know, they're already worrying about their jobs and bills and their health.
All right, so now we're gonna, I'd like to introduce you to our research team. We have Carrie Briggs, Leighton Watts, and Mercedes Aquilini. They are our all-star team from the Cicero group. And I'm totally biased, but they've done great work for us in additional reports that we did with them pre-pandemic. We did 4 state economic impact reports. If you haven't read those, I'd encourage you to read them. But we felt like, you know, in March, we quickly pivoted and said we really needed their expertise, their ability to find connections and themes and really do high quality research for us. It felt really crucial. So I'm going to let them dive into the impacts on both, are on parents, employers, and providers, and then we'll have Q&A at the end. But I'm going to leave it now to Carrie. Or maybe Mercedes.
Yes, thanks, Julia. All right, well, there is a lot that we could say about working parents. I'm going to highlight just a few key learnings here, but there's a lot more in the reports, as Julia mentioned, if you want to dig in further. Briefly, just as Julia stated, we surveyed parents who were recently employed, so employed within the last 6 months, and who had children under the age of 6. We surveyed a diverse group of parents across income levels, industries, states, and we're going to be representing the overall findings here, but in a few cases we've called out specific instances where the data does differ significantly by gender, race, income level, etc. So as Julia stated, 2 out of 3 parents have changed their childcare arrangement due to COVID-19. And what you're seeing in this graph here is what that looks like by childcare arrangement. So here on the left, you can see that children staying at home with a parent or guardian has increased dramatically. Before COVID-19, about half of parents had children staying at home, and as of June, that jumped to 75%. However, other types of arrangements, such as children attending a childcare center or pre-K, have decreased significantly. I think this makes sense based on a lot of what we heard. We know that childcare centers had to close or reduce their capacity significantly. And in many cases, parents just chose to have their children staying at home with them, especially if they were working from home. However, this wasn't an option for a lot of parents, especially those who are essential workers. And so in that case, many parents turned to family members or friends. And so you can see there on the left that that arrangement has actually increased slightly since its pre-COVID levels. One other interesting note here, you'll see children staying at licensed childcare homes, 3 over from the right. While that did decrease, it's hovering closer to pre-COVID levels. And we did hear from childcare providers that many parents feel a little bit more comfortable with that situation because it is usually a much smaller group. However, there's a lot of competition for those slots right now. And so a higher percentage of high income parents are using that compared to low income parents. Next slide. Perfect. So with all this change going on, for many parents, it was almost overnight that they had to make these decisions, and they thought it would be short term. I think we all thought that. And so for a lot of parents, they're still really looking for long-term solutions. 62% of parents say that they'll need to change their childcare arrangement in the next year. And for many parents, it's actually within the next few months. And the primary reason for that is parents needing to return to work. That could mean returning to the office or on site. It could mean returning to full-time working hours, or it could be re-entering the workforce if they had to leave their job or were furloughed. Another interesting point here is that K through 12 school districts and their decisions also really impact parents and their childcare arrangements. So 44% of parents said they will need to change their arrangement if their local school district adopts a partial or complete virtual model. Next slide. So in terms of returning to work, in October, we asked working parents how many of them had returned to work, and overall 62% said they had returned, meaning returning to their pre-COVID work situation. However, when you look at that by gender, there is quite a big difference there. 77% of men have returned to work compared to 54% of women. I think we're seeing a lot of research right now about how the pandemic is affecting women specifically, and we definitely saw that in our research on working parents. Of those who have not yet returned to work, the majority are likely to return, but 14% of parents are still unsure or unlikely if they will return to work. And when we ask them why, the primary reason, especially later on in October, was due to childcare concerns. So I think this really highlights that this is a current issue for working parents. And even as some companies are starting to return to work or to the office, many parents are really struggling with how to help and where to put their children, find a safe childcare arrangement for them so that they can return to work. Next slide. The last data point that we wanted to highlight here for working parents is around childcare benefits that employers can offer specifically. So we showed parents a list of different childcare benefits and asked them to choose the top 3 that they felt were most important for an employer to offer. The number 1 response here was flexible working hours, especially in this current environment. Flexibility is really key for working parents. That was followed closely by paid maternity leave, as well as remote work and flexible working days. There are a few options that we asked that aren't included here because a small percentage of parents chose that option. That includes an offsite partnership with an offsite childcare provider, as well as a dependent care flexible spending account. The other thing we wanted to mention here is that these are general results. However, this does look a little bit different based on the industry. It's just the nature of our work environments that some benefits work better in a specific environment over others. One example of that is that 50% of employees in the retail industry selected flexible working hours as a top benefit compared to just 25% of employees in the education industry. I think, when you're looking at teachers, it's much harder for them to have a flexible working schedule compared to a lot of people working in the retail industry. So I think when we're thinking about employers and how they can help their working parents, it's important to look at their work environment and workforce specifically to understand what benefits they specifically want. So with that, I am going to turn the time over to Leighton to talk about our childcare providers.
Thanks so much, Mercedes, and thank you all for joining. As Julia mentioned at the beginning of the call, in addition to administering parent and employer surveys, we also conducted several in-depth interviews of providers across the country. That included both foreign nonprofit centers, home-based providers, Head Start and Early Head Start, and university-based providers. And what I'll share during this time is simply a few of the key takeaways and shared sentiments of what stood out within our provider research. But it's important to recognize that these findings represent a point in time in terms of July 2020. And so knowing that things have continued to change and evolve this fall, it's important to recognize those potential changes as well as what insights still remain relevant. So what you'll see on this slide are a few themes that were elevated across providers, across geographies and across provider types. You can read more specifics about the findings and in-depth profiles of some of the providers we connected with in September's report. The most consistent theme that was shared by providers was the overall challenge of disruption to their traditional operating norms. All of the providers that we spoke with had navigated some form of closure, whether that was mandated through a 2-week shutdown in March and April, or whether it was longer term closures that lasted well into the summer. In fact, 2 of the providers that we spoke with in July had still not reopened, and were trying to determine whether or not they would be able to do so. Once providers had reopened, they faced the challenge in terms of staffing and enrollment capacity, as most providers were operating at near 50% of pre-COVID enrollment due to a combination of state guidelines, as well as parent and family comfort with sending children to external environments in the midst of the public health crisis. These capacity challenges really were exacerbating traditional and consistent problems that we've seen through staffing and student and teacher ratios, pose challenges to incoming revenue, and have continued to be problematic as family dynamics and childcare needs continue to change, as Mercedes spoke to kind of the short-term Band-Aid solutions that we're seeing take place right now. The last piece that I want to highlight in terms of the impact of COVID-19 as of July was the critical yet challenging need for added health and safety guidelines. While providers certainly understand and adhere to strict protocols, the logistics and the cost have been extremely burdensome for most providers, whether that's helping children to wash their hands more consistently, as the video shared at the very beginning, how do you socially distance with 2-year-olds, limiting parent interaction in the home or the center and the impact that has on relationships, or trying to acquire additional PPE and materials for protocol. Maintaining the safe structures has been critical and yet a major cost to both the financial and emotional considerations of providers. Just one example that really resonated with us in our research was from one home-based provider in California that we spoke with, that mentioned in order to acquire all of the resources and materials that she needed to provide care, she would spend all weekend attending 10 to 11 different stores and locations to get masks and gloves and toilet paper, hand sanitizer, other critical materials. And she would hear that a new shipment of masks had arrived at one store, and a new grocery store had a new shipment of hand sanitizer. And so she would spend all weekend kind of piecemealing together her solutions to just deliver and provide services that were safe for the coming week. Separately, one center indicated that the latex gloves that they used on a daily basis had changed in price from $44 a box that they bought in bulk to $110 a box. And they effectively making those gloves unable to be acquired for their short-term needs. They'd reached out to community partners. They'd even reached out to parents to try to find whatever solutions were available at this time. What that initial video indicated, and what we continued to hear, was the combination of decreased revenue through enrollment challenges, as well as the increased expenses of sourcing and acquiring additional protocols, services, training, as well as PPE. It really indicated a major concern about the sustainability of operations, and that employers were concerned about maintaining their operating at this current pace on what we already know were razor thin margins. So we'll go ahead and move to the next slide. Thanks, Julia. While providers certainly acknowledge their concerns about long-term sustainability, I do want to highlight that their primary concerns were meeting the day-to-day needs of working parents and families in the short term, and doing whatever they can to ensure that all families and students had a safe and secure environment for childcare. What providers identified in July, and what they've continued to navigate this fall, is how to operate and deal with the present risk of COVID in their communities. What we heard was that in the spring, kind of at the very beginning of the pandemic, providers were trying to avoid any sense of COVID and trying to control to ensure that it didn't impact their community, it didn't get in within the 4 walls of their center or their home. But by the summer, they realized that maybe wasn't feasible, and that they needed to adapt to learn how to operate with the consistent threat of COVID in the lives of their students and families, as more and more employers return to work this summer and this fall. Separately, and what has been highlighted both by Julia and Mercedes, and continued to be a topic of conversation with providers as they looked ahead at fall 2020, was the role that K-12 played within the childcare industry. I think it's important to note from a family perspective, in terms of the parents and the students that are being served, is as local school districts determined their remote learning plans, families with school-aged children, may have had to make different decisions about their employment and their childcare needs, sometimes impacting the planned enrollment and potential revenue within the childcare industry. Separately, several providers highlighted the impact that this had on their own staff, as providers who have school-aged children as well had to reduce their own hours or potentially leave the workforce in order to support the virtual learning needs of their own families, really heavily impacting the supply of staffing within the childcare industry. And as my colleague Carrie Briggs will share momentarily, we found that collaboration and communication across sectors, whether that's K-12, the business community, the childcare industry, really is a significant area of opportunity moving forward. And lastly, something that you won't see on this slide, but want to make sure that we highlight from a provider perspective, was the concern for staff morale. And Julia, you can go back one slide. Thank you. Was the concern for staff morale. We commonly hear about social emotional learning for students, and it's an increasingly common topic of conversation. But the weight of the pandemic and the toll of the essential work on provider staff was a topic that came up time and time again with providers, as they're concerned about both the mental health and well-being of their staff, in addition to the public health concerns of COVID. And so, this we think is a really interesting space for us to continue to watch, and an area of opportunity to support moving forward. So with that, I will transition it over to my colleague, Carrie Briggs, to share a few key findings from the employer perspective.
Thanks, Leighton. As we get to the kind of third critical group of stakeholders that this work represents, just wanted to remind you that we sent this out through our state and local and national chamber partners, and got really incredible strong responses in October. The group of people who responded then, 2/3 of them represented essential workers. So really a key group of people who are connected to the economy. Just one other sort of scene setting note, we all kind of remember this and are probably still living it out, is the pandemic instituted this huge shift from working in outside the home in offices and in lots of different places to now working at home. And nearly 80% of our employers in the June survey had indicated that some or all of their employees were now working from home. And so as they're working from home, we asked them, how aware are you of the childcare needs of your employees? And you see in both instances, really strong sense that the employers knew kind of what was going on with their team and the childcare needs they had. Their sources of information, as you see on the right, were largely around informal feedback gathered by managers. Always a good source of information, right? The water cooler, those casual conversations we now all have over Zoom or phone calls are still really useful places to get insight around how employees are doing and what the childcare needs are. You see less more formal avenues for collecting information about employees and what their childcare needs are. So 13% looking at surveys or formal feedback sessions. One suggestion I'll say here and again later is that these informal networks, while being able to provide some information, may not be the only or best source of information. You could imagine scenarios where employees might not feel comfortable sharing up to a manager exactly what's going on with how they're managing work and home and children. And so we would encourage more formal uses of information. And so now that I've kind of raised this notion, like employees feel like they're aware of what's going on, or employers feel like they're aware of what's going on, how are they, to the next slide, what are they going to do about it? Like what's their willingness to potentially invest in solutions? And so what we asked is just that. How willing are you to invest in your in additional childcare needs? 20% of our employers said yes, that we're interested in increasing an investment. 35% said not yet or not now. And then 45% can neither agree nor disagree. So let's talk a little bit about the 20% who are open to increasing their investment. I think you see in that data on the left-hand side, really strong sense of employers understanding the connection between a strong workforce and an ability to care for children and have that be kind of a holistically well done thing. So retain a strong workforce, improve productivity, attracting employees, like they really see the connection between their people and childcare. On the flip side, the employers who disagreed with the opportunity to increase their investment, far and away, their biggest concern was having the funds or resources. So I think that's kind of an interesting idea, because at this time, when most organizations, most employers are still really struggling to stay, at least revenue neutral, if not profit making, or sustaining their work, adding investments at this point may not be the right thing, but you could imagine later on down the road they may be more open to it. I think there's also some interesting kind of hunches to pursue further around the 45% who neither agree nor disagree. In my mind, that signals an openness to the issue, and that once the intensity and volatility of this current time is a little bit more stable and resolved, and maybe post-pandemic, they might be more open to having conversations and thinking about increasing investment in childcare. So we know they're thinking about this a little bit. What else are employers considering as they think about their workforce? Right now, employers are worried that their employees will not come back to work. So that number remains really stable across our survey. 40% are thinking that some employees may not come back. Another third are worried that they will leave the workforce entirely. And then almost 30% are thinking that their employees may leave them and go somewhere else. And so with this kind of concern about whether or not they'll be able to bring back all the talent to the workplace in this environment, you can kind of see that portrayed on this data slide. So we asked employers what they thought was driving these changes. You can go to the next slide. They are worried that for those employees who are seeking out other employment or thinking about leaving the workforce, both health and safety rise to the top in both those cases, right? People are still very worried about the pandemic and getting sick and what that may do for their health or the health of their family. But right behind that, you see childcare concerns as an issue that may drive people to change their job or leave the workforce entirely, and then maybe less inclined to work, period. So as we think about what these data are showing us, the churn of parents still having to kind of constantly think about what's the right next step for caring for my child, providers worrying about sustainability, employers worrying about keeping their people and how to help them. These data are kind of giving you numbers behind each of those concerns that we've all been considering. So now that we've raised all these different problems, we do have some ideas around suggestions for different stakeholder groups. For employers, I mentioned this earlier, create more formal or regular systems of feedback, like ask your people what they need or what they want. Again, I think those informal mechanisms are great and have a lot of utility, but you may be missing some things without a formal system. And we would encourage employers to think about the turnover costs. It may be that the cost of adapting or increasing childcare benefits may be less than the cost of what's happening if you're losing people, or if people just aren't as efficient or as productive, or they're having to take sick leave. I mean, those are trade-offs that any employer might be wanting to think about as they consider additional childcare assistance. Think about what's most meaningful. Mercedes talked about how different industries, employers of different industries might want to offer different things. I think that some of the reports we've released have really good insights into what parents are wanting. I'd also note that oftentimes employers don't tell employees what's offered. I think we all maybe got a run through of all the benefits when you first start a job, but that might have been a year or 5 years ago. And so it doesn't hurt to go back and clearly identify and explain the supports that you have right now. And then one strong theme that we've really taken away from all of this work is considering the interconnectedness between K-12 and childcare stakeholders and trying to bring those together. So that's what we're saying are good suggestions for employers. Now for chambers, because you have a role you can play in these conversations, and particularly as the voice of business, you might be able to ask questions that an employer may not have time to do, or maybe it's just not the best role for them. So we would suggest that you proactively reach out to your local childcare providers. What are they hearing? What are they saying? What do they need? What's their openness? convene these individuals, start to be that connective tissue between K-12 and childcare and the business community, and to have these conversations. Collect data. You're great at being able to collect data, find out what's available, what's, who has space open, who is maybe stretched thin, and then consider supporting some localized research in your community, especially given that you've got good insights into how various industries may be adapting in this environment, or what that requires for families and working parents. So at the beginning of all this, Julia and I started with this theme of a childcare equation and how parents have to balance all these different variables as they wrestle with caring for children and working. I think you probably saw all those variables get talked about in this presentation today: work, home, community, family. Our hope is that these data help all of you bring new insights as parents and employers and providers start to answer this equation. So with that, I'll bring back Julia to help moderate our Q&A. And I noticed there's been tons of great questions in the chat, some of which we can answer and some of which we can't. I'll let Julia pick and choose.
Great. Well, thank you so much. And I know Mercedes has already asked some questions or answered some questions around parents. One thing I want to answer before I dive into asking the Cicero folks is that, yes, we do have all this data disaggregated by gender, race, and ethnicity. There are decisions that we made in what data we highlighted when there were trends. So if you look at all the reports, you can see in the appendix all of those, the percentage of gender and racial groups that we had as respondents. But there were only places in the report, because we only had so many pages, to highlight specifically certain trends or noticeable trends that we had. So one question I have, let's start with parents, and I have them written down for now. So I'm wondering, or someone on the chat was wondering, if working parents who were laid off or furloughed are now dependent on government assistance in some way, shape, or form to access childcare. Is that something that we saw, Mercedes?
Yeah, that's a great question. We did ask in our latest survey about the types of government assistance that some childcare parents may be on, and we definitely did see a higher percentage of those parents using programs such as childcare subsidies, whereas the broader group of parents utilized some programs like childcare tax benefits. So we definitely saw a little bit of that. I'll say that there's room to explore that even further, but that is a trend that we saw just recently in our last survey.
Yeah, and I'll add on, even though this question wasn't from you, it's from Mercedes, but why not? That's something that we've actually heard from a lot of states, is that there is a disconnect between parents who are accessing unemployment insurance since the pandemic and citing childcare as a reason why they're unemployed, and where there are gaps at the state level of just transparency of, if a parent is citing childcare concerns, could they be flagged in a system to have, data sharing? I know that gets complicated with sharing that data, but it's been something that I have heard across multiple states where parents are not going back to work because of childcare problems, and then utilizing unemployment insurance, understandably so, but there might be some state level solutions available if folks want to connect the dots. Mercedes, can you also talk about the differences that we saw in women leaving the workforce and some of the trends that were notable from the surveys?
Yes, definitely. So we saw quite a few trends in terms of leaving the workforce. 9% of women that we surveyed in October had left the workforce, compared to just 2% of men. And those women who had left the workforce overwhelmingly cited childcare concerns as a main reason for that. But even beyond leaving the workforce, we saw a lot of women just turning down job opportunities. So 13% of women who we surveyed had to turn down either a new job or a promotion, something like that, due to childcare, compared to just 7% of men. And then I highlighted earlier, just even returning to their pre-COVID situation, there's a big disparity. So pretty much across the whole spectrum of employment, we're seeing a large gap by gender.
Yeah, that makes sense. And I think that's been validated by multiple other research reports that we've seen come out in the past several months. So pivoting to providers, Leighton, can you talk about who was in that pre-K bucket? Were those state-funded pre-K providers? Were those private funders or private programs? Who was in that bucket?
Yeah, it was a combination of that. So trying to get as representative of a sample as possible, and also recognizing specifically from the pre-K lens that as we have those conversations this summer, right, we know that the parents certainly were kind of rethinking their approach to K-12 as school districts are making their decisions as well. So that can certainly be an influence from that perspective.
Great. And then also asking for Leighton, for providers, when we had heard from, they're struggling to pay for cleaning supplies or retraining staff. Had you heard about anyone accessing scholarships or either state or federal assistance to, meet some of the increased operational costs?
Yeah, great question. So certainly we had several conversations about the PPP loans, and there was kind of differentiated access to that capital. We specifically heard that several home-based providers, may not have had formal banking relationships or even known kind of where to look for information to access that type of capital, whereas, maybe larger kind of small businesses were connected through, banking relationships or even local chambers or kind of the business community that maybe did have the ability to access additional funds or resources. So I think certainly that was one element that we heard, and, others were kind of casting as wide a net as possible, right? Looking at every grant, every website, every local philanthropy, every local childcare group, trying to, kind of piecemeal together what additional funds they could to support.
And doing that while trying to maintain their program, enrollment,
exactly,
communicate with families. Yeah, okay.
Yep.
Pivoting to employers now, Carrie, can you talk about for the, I don't know that you said this on the presentation, but someone asked it in the chat. Were there employers that were willing to make some type of childcare investment with incentives, like external incentives, business incentives, tax breaks? What did we hear from employers?
Yeah, I think there are some employers who are open to that as a solution, for sure. They're maybe seeing the need to support their parents and maybe even feeling it themselves as working parents. And so this notion that bringing in an incentive to encourage parents or work with different public agencies or government agencies to solve this problem is something that we definitely saw employers open to in the data.
Yeah. And I think, something that we didn't say at the beginning of this, but we talk about the employer community. That's a very broad, all-encompassing community, right? It's not a monolith. We've got industries that have been very heavily hit from the pandemic and some industries that have thrived, right? And we've got small businesses who are struggling to make payroll and some larger businesses who have enough capital in the bank to weather this storm. And so I also want to recognize that just when we're talking about employers, we are talking about, millions of businesses across the country that aren't this monolith.
And we had great representation in the survey data from the smallest of businesses, fewer than 10 to large, very, very large employers and for-profit and nonprofit. So is a pretty big diverse group.
Yeah, that's a good point. What about, there were a couple of questions about predictive scheduling, and when we asked about flexible scheduling, did we define that in a specific way or include predictive scheduling in that?
We didn't, and I wish we would have asked that about the predictive scheduling, because I could see, particularly in like healthcare fields, or if you're in the food industry or hospitality, where your schedule might change quite a bit, that could be a really helpful option. So if we get another round at this, we'll add that to the list.
Yeah, and I think, flexibility could look like changing hours, it could change days. We've also heard from some employers who have done time blocking, where based on, the childcare needs of their workforce, I can choose to break up my 8 or 9 hour shift into multiple chunks of time. And, all of those examples that I have heard personally have been a result of the pandemic, of parents vocalizing their needs and then employers responding. So going back to providers, Leighton, what about shared services alliances? Have we heard from providers that have fared better because of shared service alliances? Are there suggestions that we have for folks?
Yeah, it's a great question. It was definitely a topic of conversation. I wouldn't say that we necessarily have the insights to make recommendations on it, but I will say that certainly was a topic of conversation, especially the challenges of staffing, of training, of reducing hours, of the kind of operational back office support that can be so challenging. Like you mentioned, Julia, providers who are wearing several different hats, right? To run an organization, to solicit funding, to source materials, that those types of things could be benefited through kind of a shared services approach. And so, some of our conversations did identify providers who said that had been either really helpful for them in, kind of shouldering that load, or something that they were interested in exploring further.
Got it. So I know we've got a bunch more questions, but what we can do is, I think some of the questions we could be answered with some of the, resources we've already put out there. There have been questions about employer solutions. We've got some more information in the survey about employers. We also created an employer video of examples of employers. We can also follow up. I'll include our contact information, if I can scroll to the next slide here, if you want to reach out and learn more. But I have one last question for each of you that I would just love for you to answer. If there's something that you want folks to take away from 6 months of surveys, whether it's something that surprised you or something that's notable, what would that be?
And for me, there's like two things that really rise to the top. Is just how important it is to have intentional conversations within an employee base or among providers about just like what the needs are and what the solutions are being offered and what's possible. I think just having that intentional conversation is super important. Second is just the interconnected nature of this whole community, K-12, childcare, employers, parents. They're all like this web of things that have to come together in order for the economy and for family life to work well and be healthy. And it's such a prevalent piece that like all of those elements need to be considered as we move forward into hopefully a more healthy economy.
Yeah, makes sense. Leighton?
Yeah, absolutely. I'll second that. And I think the thing that really resonated with me the most was, so much of our language around the pandemic this year has been about the importance of essential workers, right, and essential industries. And I think just highlighting how the nature of the childcare industry is almost effectively the essential workers for essential workers, and just what a critical role and kind of foundational role that the industry plays in employers even being able to come back to work. And as Carrie mentioned, just the interconnectedness of each different group.
What about you, Mercedes?
Yeah, I would just want to call out that it's still continually changing for parents. They're in the midst of it right now. Even if their childcare center has returned, maybe there's a COVID outbreak, and then again, they have to figure out what their arrangement is going to be. So it's a current problem that parents are facing. And so any solutions that we can come up with are very relevant right now.
Great. Well, thank you so much. So a few remaining things. One is we will have a new report next week. It will have all of this information and more, some economic impact projections that we did and additionally like all the data that we dove into today and more. So please look for that next week. We will be sending this recording out via email. So if you have questions, concerns, this is our contact information as well. And we will follow up, whether it's, reaching out to you individually, or if there are, groups of questions that we can batch together to provide you some of the answers, we will. The one thing, since I've got the floor, that I would add is that I have been shocked, and if you've heard me talk on any webinar since the pandemic, we have really been shocked by how open and aware employers are to the needs of working parents about childcare. I don't think it's, we don't have the data that's pre-pandemic, but it really has been surprising anecdotally for us. And then the employer surveys that we did really showed that there is a level of awareness that, when you're in my home or there's a 4-year-old on Zoom, you know, it really sheds the light on childcare being a crucial workforce issue. So if you have had difficulty connecting with employers, reaching out, making the case, I really think that this is an opportunity that we have now in this time when folks are immediately aware of the need. So I just would encourage you to not lose hope and continue to try again to develop those relationships, because we have seen an awareness. And I think there's a question about the 45% of employers who are on the fence about, you know, making those investments. To Carrie's point, I think we have an opportunity here to really, build on the momentum. And lastly, if you are a childcare provider who has been serving families and children during the pandemic, we just want to thank you so much, because we know how incredibly hard you're working, and that it's, you know, I can only imagine the stress of operating a childcare program in this time. So just thank you for taking the time to join us today. And with that, thank you so much.